My name is Dr. Mark Kallgren. I am a board-certified anesthesiologist and interventional pain doctor. Been doing this for a long time. 2.5 decades, we'll leave it at that. Well, I'd say it's my one favorite thing about doing pain management or interventional pain management in general, which is I enjoy the opportunity to see people that come in that sometimes are fairly desperate, don't really think there's much that can be done, and in a short period of time gain their confidence, turn things around, and have them thank me for giving them their lives back. That may sound extreme, but that happens frequently, and I'm blessed to have the training and to live somewhere where I can do that and offer my skills, and this clinic really provides the opportunity to do that for a lot of patients. So I'm originally an Arizona-trained graduate. I went to the University of Arizona Medical School, did my internship in Tucson, then went away to the University of Texas system where I did my anesthesiology residency and pain training. Moved back to the University of Arizona for a few years on faculty. It was a long time ago, but actually helped start their pain clinic because at that time they didn't have a fellowship program. And then up until 4 years ago, I was in Oregon for over 20 years where I was the medical director of a large anesthesia group for the pain part of the group. And I've done a lot of things along the way, written book chapters, done a lot of research, was on the board for my group for a long time, spoken nationally and internationally on various pain topics. So I've had a lot of opportunities through my career to learn a lot and hopefully give back. I really like learning new things, so that's another exciting thing about this practice. So I really enjoy hiking and backpacking and fly fishing and skiing. Basically anything outside I'm very into. Ultimately, pain, I always tell patients this, there isn't a test. Think about this. We live in 2023. You can have a heart transplant done in an outpatient surgery center, just about. I mean, we're putting aortic valves in through the groin. The stuff that's done right now is amazing. Tell me what blood test there is to prove that somebody has pain and where the pain's coming from. It doesn't exist. There's no MRI, there's no PET scan, there's no CAT scan. So that brings a lot of things to the table because you're dealing with something that has a lot of organic basis, but psychological factors always bear on it. And anybody that's ever had a really bad night and has a pain problem will tell you, well, I'm miserable the next day because I didn't sleep, I didn't get restorative sleep. So you have to really kind of look to be very comprehensive and very, I like the word integrative. I personally think there's great value in anything that works that's not crazy or that might take a patient away from a more traditional line of treatments.
What's a favorite quote that stands out to you?
All bleeding stops eventually. That's one of many. I have a lot of cliches or axioms that I quote. Control is just an illusion. People live their whole lives thinking, if she's mad at me, I'm gonna do this, she'll be happier. That's not true. She's gonna be happier if she wants to be happier. I can't make that happen. I can be the best version of myself, and if that makes her happy, that's wonderful. But it doesn't go both ways, right? She can't make me happy or unhappy. So there's a lot packed into that. And I do say that to my kids all the time. It's like, look, bad day, someone cut you off in traffic, all those things. Like, you can't control all that. You can control how you react to that. You don't get to control what that person's going through, nor do you know. That person may have cut you off, and you think they're a horrible person. You don't know their dad may have just died, and they're just having a bad day. Don't think that you have control over the universe. Just accept where you're at, try to be the best version of yourself, and try to give back.